Assalamu alaikum warahmatullahi wabarakatuh. This is Mia Anis.Rahman, final year MBBS student at Abbottabad International Medical Institute, and you are watching Anis.Medventure. Well, this video is fourth part in our discussion on modular system and general guidelines for MBBS. First, we made a general video on modular system introduction and approach. Second, we made a video on first year MBBS modular system broken down into two parts. Third, we made a video on second year MBBS, and now this is the fourth video, which is on third year MBBS modular system introduction and approach and general guidelines. So this was just for the sake of orientation. Let's begin with the formal discussion. As usual, we will break down this video into 5 domains, and with the disclaimer that this might get longer, and like previous videos, we might need to break it down into 2 parts. So the 5 domains which we will be discussing: number 1, some general considerations. 5 general considerations. You can skip this part if you have watched first year and second year MBBS videos. Second part will be the subjects in third year MBBS. Third part will deal with blocks and modules and how the subjects are integrated into modules and blocks in third year MBBS. Fourth part will be about resources, learning oriented resources and exam oriented resources that are recommended to be used in third year MBBS. And the final part, fifth part, will be an example of how to integrate a learning oriented resource and exam oriented resource to get maximum benefit out of the modular system. Well, with this we come to our first part, that is general considerations. Yes, well, there are 5 general considerations I consider that every first year MBBS student should know. Number 1 is that once you step into MBBS, this is a different world than your FSC or A-levels you were in at your college, because now most of the time you are on your own. In FSC or in A-levels, specifically in FSC, your teachers used to hold your finger and walk you step by step towards your exam, towards your studies, every question marked, and same syllabus you have studied, whatever you have studied, that was supposed to appear in exam. But that is not the case here. Here the resources are extensive, the syllabus is extensive, and your teachers at college are mostly your facilitators rather than step-by-step teachers. So you have to more depend on self-study. So this is first consideration you have to keep in your minds. Yeah. So secondly, you have to understand that do not fall into the trap of comparison. This trap of comparison is very dangerous demon which will eat you from inside. By this I mean that don't compare yourself with others in your class, who is using what, or who is studying from which resources, who is studying from which thick book and I am studying this smaller book, or someone is studying from three resources and I'm only using one resource, and someone is scoring above 90th centile and I'm just going above 70. And this comparison and comparing, if you are a private student, comparing yourself with a student at public medical college. So this comparison, this is just abolished once you enter into a professional degree. Not just for MBBS students, but students at large. Once you enter into a professional degree, you are colleagues more than competitors. So you have to help each other out rather than competing with each other. So helping will bring you more. So you have to go with this abundance mentality and this cornucopia of abundance rather than restricting yourself with the specific resources which you don't want to share with others. So that mentality won't work here. That is the second consideration. Thirdly, you have to understand that now you have to balance between learning oriented study and exam oriented study. Well, I won't discuss this in detail. We'll integrate this learning oriented study and exam oriented study into the resources which I'll discuss at the end, because I have broken down resources also into learning oriented resources and exam oriented resources. But for the time being, you have to understand that learning is an attitude which you have to develop. It's not a choice that, okay, today I want to learn something, let's go to the school and I'll learn something. It's not that way. It doesn't work that way. learning is an attitude, not a choice. So you have to be of learning mentality. So if you have learning mentality, in whatever situation you are, you'll never be bored. So if you are of learning mentality, you will love what you do. And that is my next consideration. That is the fourth consideration, that love what you do. It is rightly said that if you love what you do, you will never have to work a day in your life. So how do you love what you do? Well, for that reason, for that purpose, you will have to respect what you do. Respect comes first. You might have heard na, that adab pehla kareena hai mohabbat ke kareenon mein. So if you start with respect, respect yourself, respect your institute, respect your teachers, respect your colleagues, whatever comes in front of you, if you just learn how to respect someone, somebody, or something, you will just achieve a different level of bliss. And I just don't want to go into the details of psychology, but that's the fourth consideration I want you to make, that love what you do. And number five, otherwise you will be exhausted by the end of the day. And number five, find true mentors. And that's very true, because see, there are a lot of online resources in this digital world. What I am talking to you is through an online platform, but while talking to you through a video, I am asking you to not depend solely on videos. How ironic is that? But that is true. That, see, not everything can be caught up by online resources. You have to talk to your seniors, you have to find mentors. So finding a mentor, this is a fifth consideration, finding a mentor who is sincere, who is honest, and who is capable of being a mentor. That is very important, and that is very true for myself. Even when I went to first year MBBS, I didn't even know A of anatomy, but I found a mentor, alhamdulillah, and then things paced up. So finding a mentor in professional degree is very important, because see, now it's just like you talking to your friend on a video call, and you sitting with your friend at a restaurant, talking and eating and hugging and smiling and laughing, and both feelings are different. So it's just like watching just videos like this, or talking to a mentor. These videos can facilitate you, this can help you, these can supplement your primary education, but they can never replace it. So these are the five primary considerations I want you to make once you enter the first year MBBS. After you have made these considerations, now we go to the second part of this discussion, that is the subjects in third year MBBS. Well, this needs to be understood that the transition from first year to second year was very smooth, but the transition from second year to third year is rather blunt and not smooth, because the subjects are going to change entirely, and you will have to make strategies to tackle with these new subjects again as you made in first year MBBS. Here the subjects are five baskets I will make of subjects. Number one, pathology. Number two, pharmacology. Number three, forensic medicine. Number four, community medicine. And number five, vertically integrated subjects basket. Well, in third year MBBS, the pathology, this is a new subject, but you need not to be afraid of it, because you will come to understand that pathology is the basis of disease. Once you understand the disease, it becomes easier for you to understand the medicine and other aspects of MBBS at large. So number one, pathology. And of course, in third year MBBS, with pathology, you study microbiology. Microbiology also is a part of pathology, but we will deal in our discussion them as separate subjects, because there are separate dedicated books for both of these subjects, pathology and microbiology, both of them in first basket, that is pathology. So first subject, pathology. Second is pharmacology. Pharmacology is one of the most dreaded subjects of MBBS, because there is a lot of rote learning and retention that is needed in pharmacology. We'll discuss it along. Third subject, forensic medicine. Forensic medicine looks like a dry sort of subject to many students, but it is not so, because it can be as interesting as any other subject of MBBS, and you will know in our discussion how and why. Now, the fourth subject is community medicine. Community medicine, there is some proportion of community medicine in third year MBBS, but the larger proportion will be in fourth year MBBS. So we'll discuss community medicine in detail in our video on fourth year MBBS. Here we'll just discuss its integration into the modular system and a little chunk which is discussed under the syllabus of third year MBBS. And fifth, vertical integration in third year MBBS, of course, medicine, surgery, and other allied subjects. There are lectures and topics which need to be studied in third year MBBS. With this overview of new subjects, we come to the blocks and modules which are there in third year MBBS. Well, in third year MBBS, you will again have 3 blocks. In first year, you had ABC, then DEF in second year, now G, H, I in third year MBBS. In block G, you will have 2 modules. Number 1, Foundation 2 module, and number 2, Infection and Inflammation module 2. Well, you might be remembering that you studied Foundation 1 module in first year MBBS. That was mostly physiology, anatomy, biochemistry, basics. Now you are studying Foundation 2. This will essentially be similar to that Foundation 1, but here it is for advanced subjects, that is pathology, pharmacology, community medicine, forensic. So, Foundation 2 module and Infection and Inflammation module. How subjects will be integrated into them? Of course, in Foundation module, you will be learning about general aspects of pathology, microbiology, forensic, pharmacology, and community medicine, introduction to these subjects. In pathology, you will discuss some units of general pathology, and in pharmacology, you will discuss some units of general pharmacology. In forensic medicine, you will discuss units of law, certain units of law, how law proceedings are done, and how medicine is integrated with forensic, and what is forensic jurisprudence and forensic medicine. So general things about forensic medicine, and same goes for the community medicine and vertically integrated subjects. There will be some lectures which you will have to take. So this is about foundation module. As far as infection and inflammation module is concerned, that will become more specific towards infectious disease. As the name of the module is concerned, you can just know it from the name that it will be mostly infectious diseases, and that is microbiology. So almost all of the microbiology of your MBBS, I said almost all, and I recommend that you study all of the microbiology in your third year MBBS, because as I already told you, that modular system is not refined enough to make an exam that is designed on the basis of syllabus. So most of your syllabus is of microbiology is in third year. So sometimes the syllabus of microbiology which is in fourth year is tested upon in third year, because there is little syllabus of microbiology in fourth year. So I recommend you that study microbiology as a whole in third year and get it done for once and for all. So microbiology will be an infection and inflammation module. And of course, in pharmacology, you will have antibiotics, antifungals, and antiprotozoals and metazoals. Some of them are in fourth year, but I recommend you to study them in third year with microbiology. So, and in forensic medicine, some toxicology and how to proceed with management of poisoning, these little general things. And in community medicine, now you will see in your syllabus that the microbiology, most of the topics of microbiology and infectious diseases, they are mentioned under community medicine in your modular syllabus. So if you study your microbiology completely in your third year MBBS, you will be covering most of the part of your community medicine in block G by studying just microbiology. Or if you are studying community medicine, you will be covering most of your microbiology. So these two both of them go hand in hand, microbiology and community medicine, as far as block G is concerned. As far as vertical integration is concerned, there will be some topics which you will see. We won't spend much time on that. So this was about block G. Then comes block H. Block H is subdivided into 3 modules. That is multi-system module, blood and immunology module, and then musculoskeletal module. As far as the multi-system module is concerned, it is mostly composed of autonomic nervous system, the oncology. So these are the major topics, and you will study pathology of these topics, pharmacology related to these topics, and forensic medicine. You will study some poisons such as organophosphate poisons that are related to autonomic nervous system, and some topics from community medicine and vertically integrated subjects. As far as uh, the second module, that's blood and immunology, is concerned, of course, all pathology of blood and immunology, as you studied in blood module in first year MBBS. You study physiology of the blood. Here you will study pathology of the blood and immunology, of course, and related pharmacology of blood and immunology, and then some topics of forensic medicine and this community medicine. So this is mostly this module is mostly predominated by pathology and pharmacology. Then come musculoskeletal module. Musculoskeletal module, as the name indicates, pathology of the muscular system and skeletal system, and skin integumentary system, that you will study in this module. And in pharmacology, you will study prescriptions and drugs for some common diseases such as scabies. And in forensic medicine, there will be few topics, and in community medicine, there will be few topics. And you will also, in this block H, you will study thanatology, that is study of death in general in forensic medicine. So this is a general overview of block H. Then comes block I. Block I has 2 modules, that is CVS and respiration. CVS 2, respiration 2. You might be remembering in block C, you studied CVS 1, respiration 1. Now this is CVS 2, respiration 2. So you are seeing how this is like a spiral step ladder where modules are integrated, not just in the subjects are integrated into blocks, but blocks further are integrated into years, like a spiral as you go up. So you studied CVS 1, 2 in first year, now you are studying CVS 2, CVS 1 and respiration 1 in first year, and CVS 2 and respiration 2 in third year. Here you will be studying pathology, pharmacology, and toxins and poisons of cardiovascular system and respiratory system, as far as forensic medicine is concerned, in this block. So this is essentially about an overview of 3 blocks and 7 modules of third year MBBS. First was general instructions, number 2 was subjects, number 3 was how these subjects are integrated into blocks and modules,